A very warm good evening to all of you. I'm Dr. Mansi from Homeopathy 360, and I'm very happy to say that today we have Dr. Sukhjeet Kaur from Punjab, and she's very young, enthusiastic homeopath. She's dedicated to providing comprehensive treatment for infertility through homeopathy and natural medicine. Dr. Sukhjeet holds special interest in dealing with female infertility issues and assisting women suffering from different kinds of stress, anxiety, psychological disorders, and postpartum depression, stress, incontinence, and eating disorders. Since childhood, she wanted to be homeopath as her mother was saved from major surgery with the help of homeopathic medicines. No one in her family is using allopathic medicines ever since she got treated. A very talented and innovative homeopathic doctor today we have, and she has been awarded with various awards for her dedication towards the field of medicine. A topper throughout her graduation, she excelled as a medical student. She's a PhD from Tantia University, Sri Ganganagar, and as a mother of two kids, her entire enthusiasm and experience for more than a decade has helped her understand and emphasize with couples who are facing it now. She's a very experienced doctor and has been awarded with various awards and achievements. Let's have a look. So Dr. Sukhjeet Kaur ma'am has been awarded with Bharat Shri Award 2025 by ABC Association, International Women's Day Inspiring Award by Indian World History Museum, Homeo Gaurav Award 2024 from Arogya Guru M.L. Sehgal, Punjab State Award for Gold Medal in MD Homeopathy. She has been also awarded with Appreciation Award on Independence Day celebration by SDM, above her for Gold Medal in BA MS. Appreciation Award on International Women's Day by Punjab. Sabya Charak Manch Award for Gold Medal in BHMS. Excellent in certificates from RS Bhargava Pharmacy, Gold Medal in BHMS, and various other medals also in her excellence performance in her graduation plus in her practice. We are very happy to have Dr. Sukhjeet Kaur ma'am today on the platform of Homeopathy 360 in the Beyond Boundaries series, in which we are going to learn a lot today. And I welcome Dr. Sukhjeet Kaur ma'am. And thank you so much, ma'am, for being the respected speaker of this webinar series. Thank you so much, ma'am. And the platform is all yours. And we all are waiting to gain insights and to gain information through your experience and your practice. She also gave her clinical tips on her social media, and and those clinical tips are our favorite, and we like them a lot. Thank you so much, ma'am. Yes.
Thank you, Dr. Mansi, for such a warm welcome and such a wonderful introduction. I guess everybody is doing their best in our field. So, itna praise karna bahut zyada ho gaya. And
no, ma'am.
to everyone,
you really deserve this, ma'am.
Actually, I guess it's been 3 months you were trying to have me here, है ना? And sorry, मैंने आपको इतना wait करवाया, इतना लंबा.
That's fine.
For everyone in the audience, even today, I do not have any presentation to give here. It will be totally एक बात करेंगे हम लोग, because I was not able to create any PPT or anything. मेरे को time ही नहीं मिला बिल्कुल भी throughout, है ना? बहुत busy चल रहा है. Sorry for that. And I hope we have enough members here so I can start with our session now.
Yes, ma'am. Yes, ma'am. Sure. We have enough audience.
Right.
The session will be also available on the YouTube after that. So we can start.
Okay. Right. Thank you. Thanks a lot. So as I always say this to everyone, whosoever is from homeopathic field, the kind of motivation from my side, which you can take it as ki whenever we are studying our science, whenever we are studying the anatomy, physiology, the allied subjects along with the homeopathic subjects, हमें genuinely इस तरीके से उसको स्टडी करना चाहिए कि even if you are sitting in a group of allopathic experts, you should be able to answer each and everything. So, starting with this motivational point for everyone, today I'm here to discuss about infertility. As Dr. Mansi introduced me, I'm working as a homeopathic infertility specialist. वो लोगों को सुनने में अच्छा लगता है ना कि आपका अपना एक specialization है. So I personally feel when you take one niche as your expertise, then you excel in that field. And everyone, I guess, should do that. So I have chosen infertility as my niche of working, and it's been almost since 2008 I'm working in this, and have cured multiple challenging cases also. So starting with my insight on infertility, basic से ही हम start करेंगे. What actually infertility is, types क्या होती हैं, क्या क्या causes हैं, how male infertility and female infertility is different, and causes क्या हैं, and what is actually the insight, and कहाँ तक we being as homeopaths are capable of handling those cases. And one thing I always tell to everybody who's listening to me is that ki, being a homeopath, we should always be aware of kya scope hai or kya limitations hai. Until unless we are not aware of the limitations, na, we will make a fun of homeopathy in common people. लोगों को मजाक बनाने में 1 second लगता है कि इनको कुछ नहीं आता. Everyone out of us, we face this. Even I was like once upon a time I was working in a government hospital. So this happened to me also कि एक MD doctor थे. That was very initial years of my practice. So I had a cardio का patient जिसका ECG था. Initial years में थोड़ा सा होता है कि you do not have that level of confidence, right? तो I sent that patient for second opinion to an MS कि आप एक बार उनसे लेके आइए opinion कि what he says about your ECG. And the doctor clearly said कि इनको आते तो है नहीं ये टेस्ट देखने और ME टेस्ट करवा लेते हैं, being a homeopath. पेशेंट ने अपने आप उस डॉक्टर को रिप्लाई दिया कि आप रहने दो, मैं आई विल गो टू दैट डॉक्टर एंड दैट डॉक्टर इज गुड इनफ टू ट्रीट मी. सो बट स्टिल वी बीइंग होम्योपैथ्स वी फेस दिस एवरी नाउ एंड देन. तो जब तक हमें स्कोप और लिमिटेशंस क्लियर नहीं होंगी कि कहाँ तक हमारी साइंस इज केपेबल ऑफ हैंडलिंग दोज केसेस, हम मजाक बनाएंगे और वो डेफिनेटली हमें नहीं करना होता है. बीइंग बीइंग कि हमारी साइंस प्रोग्रेस कैसे करेगी, अदरवाइज नहीं कर सकती, राइट? So what actually infertility is, coming to the point, infertility means when a couple is trying to conceive, they are planning for their family for one long year without using any kind of protection, but they are unable to conceive. आप 1 साल के लिए रेगुलरली ट्राई कर रहे हैं, नॉट इंटरमिटेंट, इट शुड बी रेगुलर, and you are trying for one long year without any kind of protection, without any kind of OCPs or anything, but still you are unable to conceive, then it is considered infertility. But अगर वो patient, वो couples का age has advanced to more than 35 years, उन cases में if they are trying since 6 months and they are unable to conceive, we consider it as infertility. अब infertility के we have basic types, 2 types. One is primary infertility and the second one is secondary infertility. When to consider it as primary infertility and when to say it as a secondary infertility? अगर कोई फीमेल बिल्कुल कभी भी कंसीव नहीं कर पाई, उसका यूपीटी यानी यूरिन प्रेगनेंसी टेस्ट कभी भी पॉजिटिव नहीं आया, then it is primary infertility. But if that patient conceived, UPT positive आ गया था, and maybe in USG बच्चे का हार्ट बीट नहीं आया, या after like a few weeks miscarriage हो गया, then it is considered secondary infertility. Means the patient is able to conceive, but now she is unable to. This is a basic difference. Even if we have many times the couples are there जिनका एक बच्चा होता है, after that for some time they were on OCPs कि अभी हमें like for 2-3 years we are in family planning, अभी हमें बच्चा नहीं चाहिए, and later on we'll try. उसके बाद they are trying for 2 years, 3 years, 4 years, but they are unable to conceive, then also it is secondary infertility. This is the basic difference, and I hope I am clear on this. And in between भी आपका कोई question हो तो you can, I guess, ask me. I'll try my best to answer to everything. And these are the types. And now the second जो इसमें हम segregation देते हैं, that is female infertility and the male infertility. तो mostly एक myth रहता है कि more of the cases में female ही कॉज होती है इनफर्टिलिटी का, बट एक्चुअली साइंस के अकॉर्डिंग दिस इज नॉट राइट. Female contributes to 33% of all the infertility cases. Male also contribute to 33%. And in other 33% cases, there are चांसेस कि दोनों में कुछ ना कुछ कॉज है जिसकी वजह से दे आर अनेबल टू कंसीव. तो अभी अगर हम सबसे पहले कंसिडर करते हैं कि मेल में क्या क्या रीजंस होते हैं, व्हाट आर द कॉजेज इन मेल. तो सबसे पहला थिंग इज कि वी एज वी ऑल नो द स्पर्म एंड ओवम हैज टू मीट फॉर फर्टिलाइजेशन एंड देन द प्रेगनेंसी हैपेंस. तो जब हम बेसिक फिजियोलॉजी की तरफ जाते हैं, वी नीड टू अंडरस्टैंड दैट फर्स्ट ऑफ ऑल. ओनली देन we will be able to find out what is the cause behind, either it is in male or in the female. तो basic physiology क्या है? As we all know, there is a menstrual cycle. उसमें आपका हार्मोन का सर्ज होता है. There is सबसे पहले FSH हाई जाएगा. Follicle stimulating hormone is increasing, which helps to stimulate the follicle, and eventually that follicle grows to a size जहां पे जाके मैं थोड़ा सा ज्यादा टेक्निकल टर्म्स नहीं यूज करूंगी बिकॉज आई गेस एवरीबडी शुड लाइक अंडरस्टैंड दिस प्रॉपरली, है ना. तो एफएसएच क्या करेगा, दैट इवेंचुअली टेक्स इट टू द फॉलिकल मैचुरेशन एंड देन द ओव्यूलेशन हैपेंस. दैट इज approximately the midway of your menstrual cycle. Approximately we can say that is 14th day of your cycle. बाकी वो vary करता है patient to patient, cycle to cycle in everyone. तो when the ovulation has happened, now the ovum has come from the ovary to the fallopian tube. Up during those days when you have your fertile window is approximately 3 days plus minus both sides of your ovulation day. So if you are ovulating on the 14th day of your cycle, every cycle, तो 11th day से start करके 17th तक we will count it as fertile window. Now, if you got intimate in those days, especially 11th से 17th day के बीच में, if you got intimate and the sperm entered the female tract, now that sperm is going to travel all way from vagina to the uterus and then to the fallopian tube. There the fertilization happens, and then if the fertilization has happened, that zygote formation has happened, that comes back to the uterus, and most likely in the fundal region that implantation happens, which we call eventually as कि pregnancy हो गई है, right? तो अब जब हमें क्लियर है कि what the physiology is, now we will easily be able to understand कि कहाँ पे लूप होल्स हो सकते हैं, कहाँ पे बैरियर्स हो सकते हैं, because of what a female is unable to conceive in the female causes and what can be the reasons in male. तो अगर हम पहले मेल इनफर्टिलिटी के बारे में बात करते हैं तो मोस्ट प्रायर इज आपका स्पर्म का क्वालिटी कैसा है. स्पर्म की क्वालिटी इज जज्ड बाय 3 फैक्टर्स. नंबर 1 इज आपका उसका जो क्वांटिटी है वो कितना रहेगा सीमन का. नंबर 1 इज द क्वांटिटी. नंबर 2 इज द मोटिलिटी. इफ यू डू नॉट हैव गुड मोटिलिटी तो देयर आर चांसेस कि प्रेगनेंसी नहीं होगी. और अदरवाइज व्हाट आई हैव सीन इज कि अगर पुअर मोटिलिटी होती है स्पर्म में, एक्टोपिक प्रेगनेंसी होने के चांसेस बहुत हो जाते हैं, राइट? क्योंकि दैट स्पर्म इज नॉट एबल टू ब्रिंग दैट zygote बैक टू द यूट्राइन कैविटी. एंड थर्ड इज द मॉर्फोलॉजी, द स्ट्रक्चर. उसमें आप हेड देखते हैं, टेल देखते हैं, इफ देयर इज एनी डिफेक्ट. एंड मॉर्फोलॉजिकली इफ दैट पर्सन इज हैविंग more than 4% of normal structure, then it is good to go. And motility wise, it is required at least minimum 40% of the sperm should be motile. And ideally what we consider is कि 15 million से ऊपर ही sperm count होना चाहिए in your semen. Only then it is considered normal. Otherwise that patient definitely needs treatment for this. अब बहुत बार होता है कि आप causes ढूंढते हैं. This is कि how you analyze कि that male is having infertility issues या that is normal, उसमें कुछ प्रॉब्लम नहीं. अब जब आप इस लेवल पे आ जाते हैं, आफ्टर दैट यू हैव टू चेक कि व्हाट इज द रीजन बिहाइंड दिस. male infertility, why that person is not having good semen उसका sperm count, या why the motility is not good, or why the morphology is bad. इन सब चीजों को चेक करने के लिए you need to check patient का stress level, उसकी daily habits क्या है, if that patient is consuming alcohol or not, if that patient is consuming tobacco or is smoking, or even pan masala has very adverse effects on the semen or the sperm quality, I'll say. तो ये सब चीजें we need to check. What is the patient's lifestyle, उसका sleeping pattern कैसा है. And one more thing, I had put a video of this also, कि even जो most people have the habit of keeping their laptop in their lap actually near their testicles. That is not a good habit to follow. आप जब वो इस तरह से you keep your laptop there, your laptop generates a lot of heat, and we need to understand this being doctors, कि why the testicles are out of your body, out of your abdomen and not inside, just because abdominal जो temperature होता है that is high, and testicles में scrotum में जहाँ पे sperm है, that place is comparatively cooler. Otherwise sperm dead होता है heat से, and you have to be careful for this. सो ये सारे फैक्टर्स को आपको चेक करना है, पेशेंट को गाइड करना प्रॉपरली कि दीज आर द फैक्टर्स व्हिच कैन अफेक्ट इवेंचुअली योर स्पर्म काउंट, एंड यू हैव टू बी केयरफुल अबाउट दिस. Coming on to the female infertility issues, there are a lot of things we all know. So I'll put a light on this. Starting from, everybody knows PCOD or PCOS, that is the like foremost cause जिसमें ovulation नहीं हो रहा है, egg mature नहीं हो रहा है, and obviously if you are not ovulating you cannot get pregnant. तो PCOD, and there is a difference between PCOS and PCOD, and बहुत frequently question आता है कि what is PCOS and what is PCOD. So PCOD is polycystic ovarian disease and PCOS is polycystic ovarian syndrome. When you just have the polycystic ovaries, it means your sonography is saying you have multiple cysts in your ovaries. That is PCOD, polycystic ovarian disease. That is it. But when it is associated with your thyroid imbalance, when it is associated with your testosterone level ka imbalance, then when it is associated with other hormones ka imbalance, maybe it is FSH, LH, or maybe prolactin is there, है ना, या प्रोजेस्टेरोन, कोई भी हार्मोन्स का imbalance रहेगा, and then you are having this, plus you have constant weight gain, and you have hirsutism, that is the unwanted facial hair are there, and plus you have irregular menses. ये सब जब आ जाता है तो then you have to diagnose it as PCOS and not PCOD. Polycystic ovarian disease मतलब खाली आपका sonography का report is saying that there are multiple cysts. That patient may be menstruating regularly. That patient may be having normal weight. Then it is PCOD. Then comes the other factor which comes is कि बहुत बार हमारे mind में एक doubt रहता है कि if a person is having uterine fibroid, यानी कि जिसको local language में भी से मांस वाली रसौली, PCOD is pani wali rasoli, and this we call it as a mass wali rasoli. So when a person is having a uterine fibroid, बहुत सारे लोगों के माइंड में ये एक मिथ रहता है कि while having uterine fibroid you cannot conceive. So ये black and white नहीं है. You have to be very aware of it कि किस केस में uterine fibroid can hinder the pregnancy, and in which cases it will not be hindering the pregnancy. Definitely that is going to be a high risk pregnancy. That in that case you have to be careful when that patient is having uterine fibroid. But ये कह देना कि fibroids है तो आप पहले इसकी सर्जरी कराइए या इसका ट्रीटमेंट करवाइए, only then you can get pregnant, is absolutely wrong. You have to be very careful about this thing. So when talking about the uterine fibroid, most likely when the uterine fibroid is in the fundal region, chances of getting pregnant gets lower to an remarkable extent, I will say. And otherwise, if you are having the uterine fibroid in the anterior or posterior myometrium, that hardly affects until unless that is a very big size, maybe like 4 centimeter, 6 centimeter. Even in my experience, I have seen a patient having 8 centimeter size ka uterine fibroid delivering a baby with C-section. though that patient was on absolute bed rest during the later stages of her pregnancy, but it was not that she was unable to conceive, it was not that she was unable to deliver the baby. So we have to be aware of this thing. After that comes एक आजकल बहुत बड़ा वो चल रहा है endometriosis. What is that? We need to understand this. As we are aware of that the mucosa, the internal lining of uterus, that we call it as endometrium. So when a female get the similar kind of mucosa outside the uterus in her pelvic area, anywhere outside the uterus, then क्या होता है कि when you are menstruating, from the uterus you have a space, a way out to expel out those secretions, the mucosa, जो भी वो during that period जो भी आपका overgrowth हुआ था endometrium का, मतलब your uterus was preparing to get pregnant but it couldn't, so eventually that is flushed out of your body, right? There is a way, there is a passage, but in your pelvic area, apart from the uterus, there is no way out. You can have this mucosa around your ovaries, around your fallopian tubes, near to your rectum, near to your adhering to your intestines also. I have seen the cases. So whenever this endometrial mucosa grows in the pelvic area, apart from uterus, so every cycle when you are menstruating, that endometrium is bleeding. वहां पे भी उन एरियाज में भी, बीट योर ओवरी, बीट योर सराउंडिंग योर फेलोपियन ट्यूब, बीट सराउंडिंग योर इंटेस्टाइन्स, वहां पर भी एंडोमेट्रियल ब्लीडिंग हो रही है, बट देयर इज नो वे आउट, सो दैट स्टार्ट्स गेटिंग एक्यूमुलेटेड देयर, and this is how the endometriosis develop. एंड एंडोमेट्रियोसिस डिटेक्ट कैसे होता है? बहुत बार पेशेंट्स को लगता है कि शायद आप नॉर्मल अल्ट्रासाउंड करवाएंगे एंड यू विल हैव, उसमें एक एनालिसिस आ जाएगा कि यू हैव एंडोमेट्रियोसिस और यू डोंट हैव, बट नो, एंडोमेट्रियोसिस को डिटेक्ट करने का द वन एंड ओनली वे इज लेप्रोस्कोपी. दैट इज अ सर्जिकल प्रोसीजर जिसमें कैमरा इंसर्ट करके एंड देन इट इज checked कि आपका endometrial lining जो है that is growing in your pelvic area, and most likely I'm sorry, most likely what the gynecologists do while performing this laparoscopic procedure, they do the surgery too and they remove that endometrioma जो बाहर सब grow किया था. But we need to be aware of this कि once they remove this endometrioma, it is most likely to grow, because being homeopaths we know this कि when your body has the tendency of some overgrowth, disease आपकी body को नहीं छोड़ती है until unless you take proper treatment. Surgery is not a solution. Surgery only does कि आपका seat of disease बदल जाता है या फिर वो रीग्रो करता है, but at a faster pace, right? So what actually they do is कि when they remove this endometriosis, the endometrioma outside the uterus in the pelvic area, they put you on medicines जिससे आप for 3-4 months you will not have your periods. They give you the progesterone pills जिससे continuously you will not have your periods. That is kind of एक artificial menopause introduce कर देते हैं वो आपकी body में. And after that what happens? Once you stop that treatment after 4 months, 5 months, whenever, your endometrioma starts growing at faster pace. So this is where homeopathy is very efficient, and only the constitutional treatment works in this case. बहुत सारे मेरे colleagues they call me कि ऐसा केस है सुखजीत, तो क्या करें, कैसे करें? For everyone I have this answer. There is no ready-made solution to this. You have to study the case properly. You have to get the inside of that case कि क्या इसकी family history है, क्या life history है, what the patient had been through, how that patient reached to this situation. We need to understand, and only then if we are prescribing according to the constitutional medicine, and maybe in between in some intercurrent medicine is given, only then we will be able to treat endometriosis. या endometrial cyst भी होता है sometimes, that is detectable in आपका sonography, right? What after that? Next comes blocked fallopian tubes. It is very common, and सबसे बड़ी problem what I have seen nowadays is कि Mostly gynecologists are doing this at very initial stages they are sending the patients for HSG, that is hysterosalpingography. What hysterosalpingography is actually, that is आपका एक x-ray होता है after inserting a dye in your uterine cavity, and after some time we check कि वो dye that has traveled to your fallopian tubes का femoral end or not. So that is how we detect कि tubes are open or they are closed or there is some infection. But this procedure is such painful, and बहुत सारे patients में what I have seen, after HSG is performed, they develop hydrosalpinx. Hydrosalpinx is कि tubes के अंदर पानी आ जाता है. Actually, what happens is कि your tubes, because that is a very very narrow space, and it gets inflamed after the HSG is performed. If somebody out of you is aware of, जब HSG करते हैं तो for 7 to 10 days they put you on antibiotics after that, just because they know, they are aware of this, that after performing HSG the patient is most likely prone to get infection. तो hydrosalpinx हो जाना, या even patients have got TB का infection in their tubes. That is fallopian, tubercular salpingitis, what we call as. तो वो भी develop हो जाता है बहुत सारे cases में. अब ये यहाँ पे question आता है कि आपको पता कैसे चलेगा, how you can, when you can suspect कि patient might have that tubercular salpingitis, when that patient is sent for USG, preferably transvaginal sonography, not the abdominal one. Transvaginal sonography आप कराएंगे तो उसमें you can see there is a beaded appearance of the tube. So there you suspect कि that patient may have TB of the tubes. Then you send that patient for TB gold analysis. That is a blood test. TB gold आप करवाएंगे. If that your patient is having TB gold positive, then it is very clear that patient is having tubercular salpingitis. You have to treat it in the similar way you did for endometriosis. Constitutional treatment along with the intercurrent ones, whichever is whenever is required. आई गेस ट्रीटमेंट पार्ट में हम सब बहुत अच्छे होते हैं, बट दिस इज द एस्पेक्ट जो अनटच रह जाता है, बिकॉज हमें टेक्निकली नहीं पता होता कि एग्जैक्टली वेयर एंड व्हाट टू डू, राइट. तो आई एम एम्फसाइजिंग मोर ऑन दैट. तो दिस इज हाउ कि आप ट्यूब्स को ये डिटेक्ट कर सकते हैं कि वो टीबी है या नहीं है. हाइड्रोसेल्पिंक्स इज डिटेक्टेड इन टीबीएस ओनली. तो वहां से यू हैव टू बी श्योर, एंड देन यू, because until unless you do not tell your patient na what exactly the diagnosis is, where they are standing today, and what line of treatment we will be following, and approximately how much time your case is going to take, your patient is not going to trust you. उनको ये लगेगा कि नहीं, यहाँ यहाँ पे बात नहीं बनेगी. तो you have to have that confidence. आपके patient को आप पे वो confidence होना चाहिए. So after that, I'm sorry, there are many cases जहाँ पे ovulation ही नहीं होता है patient में. So what are the reasons for that? Ki the patient is having an ovulatory cycle. Many times even the anemic patients do not have ovulation. Many times there are hormonal imbalances. The basic hormones we need to get tested for infertility profile in the female are follicle stimulating hormone, then your luteinizing hormone. Luteinizing is जो बाद के 15 दिन में release होता है after your egg has released. And progesterone also you have to check, बिकॉज समटाइम्स क्या होता है कि आपके पास एक एल्डरली पेशेंट आता है, लाइक 40 के प्लस, मतलब 42 43 वाला पेशेंट, एंड नाउ दे हैव इरेगुलर पीरियड्स. आपके पास पेशेंट आता है, वो बोलता है कि अभी तक हमारा बच्चा नहीं है, या वी हैव वन बेबी बट नाउ वी वांट सेकंड वन, बट इट इज गेटिंग लेट, दे आर क्लोज टू मीनोपॉज, राइट. पता है हमें कि 45 के अराउंड एवरी वुमन गेट्स मीनोपॉज. So first of all, first foremost thing you have to do is to get that patient's FSH and progesterone checked. And then you will get to know if your patient is in the perimenopause stage or not. Once you are sure about it, then you take that patient ki haan, we can help you for your fertility thing or we cannot. We have to be very clear on this, right? So many patients, I was telling कि there are many patients जिसमें ovulation ही नहीं होता and hormonal imbalances are there. And another hormone which plays a very important role in this is prolactin. As we all are aware of, prolactin is a hormone जिसमें which releases when a mother has given birth to the baby, and prolactin hormone helps to secrete milk from the mammary glands. But what if the prolactin is on a higher side in a person who's planning for family? Raised prolactin conceive nahi hone deta. That is a very big hindrance So we have to work on that also. Same constitutional treatment, but that has to be kept in check. Otherwise, the patient will not be able to conceive. आफ्टर दैट ईटी बहुत बार हम सुनते हैं कि पेशेंट कहता है कि ईटी अच्छा नहीं है तो कंसीव नहीं हुआ, या रिकरेंट मिसकैरेजेस क्यों होते हैं, उसमें भी मोस्ट लाइकली चांसेस होते हैं कि द पेशेंट इज नॉट हैविंग गुड ईटी. ईटी मींस एंडोमेट्रियल थिकनेस. एंडोमेट्रियल थिकनेस इज योर यूट्रस की लाइनिंग. So if that patient is having somewhere ET around like 7, 8 or plus, then it is good. But if that ET is less than 7, then it is very thin to say, and we need to help that patient out of that. Definitely, once again, the constitutional treatment is the best way to cure such patients. In recurrent miscarriages, as we all have studied, Sabina is a very good medicine, CPI is very good medicine, Cecal core is very good medicine. But you need to understand your patient ki kaun se case mein kaun si medicine you have to prescribe. And for recurrent miscarriages wale cases, I especially advise to each and every patient, and this is my suggestion to each and every homeopath friend, कि आपके पास अगर कभी भी ऐसा कोई पेशेंट आता है who has the history of recurrent miscarriages, at least advise them कि for 3 months they should take treatment and not try to get pregnant. Because when they are during that treatment, in that phase of getting treated, abhi improvement ho raha hai. Meanwhile, if that patient gets pregnant and again she had the miscarriage, so that is an emotional trauma to the patient and they lose confidence in you. And that is not right, obviously, for her body. We know, because abortions, repeated miscarriages are not good for women's health. So we have to be very careful to tell the patient ki abhi for some time, like for 3 or 4 months, you have to keep a check on this, to not get intimate during the fertile window. Once you are good to go, once your ET is good, after that you can start planning, right? And after that, if I'm not missing on any of the causes, I guess I have, sorry. Yeah. So these are the causes in female ki jab infertility cause hoti, and still there are cases when the infertility is there. आप सारे test करवाते हो, but that patient is having, all reports are normal, all the investigations are within normal limits, still that patient is unable to conceive, then we call it as unexplained infertility. And in those cases, we just have to advise the patient ki aap, you take care of your lifestyle, you keep your stress levels in check, you take care of your dietary habits, and eventually you will be able to conceive. Apart from this, there are few things like what tests should be done when a couple is coming to you. So for female, you have to definitely get the blood group checked, then the CBC profile, after that the hormones, which includes thyroid, FSH, LH, as I already told, prolactin, progesterone, AMH. AMH I missed, yes. So AMH kya hai? Ki that is anti-Mullerian hormone. That is just an indicator about your ovarian reserve. Low AMH has nothing to do with कि आप conceive ही नहीं कर सकते. This is a biggest myth in the infertility sector, I'll say. लोगों के दिमाग में ये बैठा हुआ है कि if you have low AMH ना, if you are having like AMH less than 1, आपका egg quality is very poor and you are unable to conceive. No, AMH has nothing to do with your egg quality. The only thing AMH indicates is about your ovarian reserve. The better the AMH level is, that indicates that you have sufficient ovarian reserve, means you have sufficient follicles to grow eventually in the upcoming time, and you can get pregnant. And to get pregnant, you just need a single good quality egg and a single good quality sperm, which will get fertilized, and then eventually the pregnancy happens. So AMH low hona is absolutely a myth, and we need to create this awareness in people कि खाली AMH का इतना बड़ा हवा बना के आप डरो नहीं, और ऐसे ट्रीटमेंट्स की तरफ मत चले जाओ जो विच आर नॉट एक्चुअली रिक्वायर्ड. आई हैव सीन पेशेंट्स, बहुत बार क्या होता है कि पेशेंट का ईटी इज नॉट गुड, but the doctor is advising you go for IVF. We need to understand. I will come to what is IVF and when A person should go for IVF and one person should not go for IVF. We'll discuss this in the last thing. So apart from this, what I was discussing is AMH. And yes, one more thing, when you have PCOD, your AMH is high because multiple follicles are growing at a time. Your ovarian reserve has gone to another level. So you'll be having AMH more than 5 or 6. I have seen patients जिसमें 10, 11, 12 तक AMH चला जाता है. That too is not good. Higher side of AMH is also not good. उसके बारे में कोई बात नहीं करता है. We must be aware of this too. So after that, uh, there is a complex that is torch complex. Torch IgG and torch IgM test होते हैं जो हम करवाते हैं infertility profile में ही. What are that? That is toxoplasma, then your rubella, cytomegalovirus, and herpes. This is a complex. So if a lady is infected with any of these viruses, there are chances she will not be able to get pregnant. There are chances she will have miscarriage. And in case her pregnancy continues, there are chances of any kind of defect in the baby. So we have to be very careful. And this is one test, torch IgG and torch IgM, which has definitely to be tested before a person is planning for pregnancy. अब इसको रीड कैसे करते हैं, how we understand कि the patient is having that viral infection or patient is not having, the patient is on safer side. तो जब पेशेंट का सेम वायरस का इन्फेक्शन लाइक टॉर्च आपका सपोज साइटोमेगालोवायरस का आईजीजी और आईजीएम दोनों पॉजिटिव आ जाते हैं, then that patient is having infection presently, that patient is presently infected with that cytomegalovirus, right? या अगर रुबेला का आपका दोनों आ जाता है, रुबेला का आईजीजी और रुबेला का आईजीएम दोनों पॉजिटिव आता है, then that patient is having rubella infection presently. But if IgM is normal but IgG level raised side पे आता है, तो that indicates past infection, means you have the antibodies in your body and you do not need any kind of treatment for that. You just need to keep your overall health in check. If you have any issues, तो उसको आप definitely treat करिए. But if you are having IgG on a higher side, that is absolutely normal and that is nothing to panic about कि ये कैसे raised value आ गई है, इसमें कुछ problem है, ऐसा कुछ भी नहीं, right? And apart from that, there are so many things, but I guess this will be sufficient as a basic introduction and detail about infertility, because otherwise there are karyotyping, otherwise there is like coagulating factor raise hota hai sometimes, so that too is a reason for infertility. N number of things are there, but these are the basic things which actually are the causative factors for infertility in male and female, as I have discussed. तो आपके पास अगर initially कोई न्यूली मैरिड कपल आता सपोज और दे आर लाइक ट्राइंग सिंस 1 year, सबसे पहले वो आपके पास आ गया, दे हैड नॉट बीन टू एनी अदर डॉक्टर, एनी अदर आयुर्वेदिक डॉक्टर और द गायनेकोलॉजिस्ट, नो अदर डॉक्टर. तो फर्स्ट फॉरमोस्ट थिंग इज सीबीसी करवाइए, उसके बेसिक हार्मोन्स करवाइए, टॉर्च जरूर टेस्ट करवाइए, देन योर triple H markers, the hepatitis B, hepatitis C, and HIV. These triple H markers are to be done for male and female both. And VDRL is must. Blood group testing is must. We have to be aware of this thing. If that female partner is having negative RH negative blood group, so that patient when she gets pregnant, चाहे वो pregnancy continue करे till delivery या वो miscarriage हो जाए, एक mishappening हो जाए, even then if that female was RH negative, she will develop antibodies against the RH. She will develop anti-RH bodies in her body. So we must be aware of this. Ki if a person is having negative blood group, a female is having negative blood group, she has to be given that anti-RH ka ek injection within 24 hours of that miscarriage or delivery. Otherwise, she will not be able to conceive throughout her life because she has those anti-RH antibodies in her body and she will be unable to. So this is the awareness, this is the basic awareness we must create whenever, even if a child is coming to your clinic, a girl is there, and we must advise the parents that you must be aware of the blood group of your baby. If your daughter is having negative blood group, so you should prefer to marry your daughter to a negative blood group wala male person. So most likely she will be saved from this scenario and getting these injections and getting this anti-RH antibodies wala sara reaction, right? So these are the basic understandings which we must know, we must be aware of, so that we can educate people accordingly, right? So coming to the treatment part, आईवीएफ की बात करते हैं, बिकॉज इतना ज्यादा मैं बार बार बोलती हूँ कि आईवीएफ आईवीएफ, मतलब आप किसी भी बड़े सिटी में चले जाइए, बड़े बड़े होर्डिंग्स आर देयर कि आईवीएफ टू मदरहुड, आईवीएफ टू मदर, चूज आईवीएफ फॉर मदरहुड एंड पेरेंटिंग। इतना ज्यादा इसको क्यों एडवर्टाइज किया जा रहा है? जस्ट बिकॉज ऑफ द अनअवेयरनेस इन पीपल। एंड सेकेंड थिंग जो मैं हमेशा बोलती हूँ, बिकॉज वी लैक पेशेंस, द कपल्स लैक पेशेंस। Everybody is having, like, people have very good paying capacity, but you do not have the patience and you are ready to do any kind of harm to your body without understanding what actually the cause is this IVF treatment gonna help you or not? And the second thing you might have heard about is कि infertility में जब conceive नहीं हो रहा होता, तो initially they suggest IUI, that is intrauterine insemination, in which what is done, that semen is washed, उसमें concentration of sperm is increased after washing, and then that washed semen is inserted in the female body during the ovulation days, or after the ovulation has been checked with the ovulation kit. तो वो insert कर देते हैं in those specific days. That just increases the probability of getting pregnant. Otherwise, that is not a treatment of any other cause of infertility. We need to be aware of this. IUI बोल देते हैं पेशेंट को कि आप IUI ट्राई कर लो, कि कॉज कुछ और होता है, सपोज एग ही नहीं बन रहा पेशेंट का, एंड यू आर सेंडिंग दैट पेशेंट टू IUI, that is absolutely of no use. That is absolute waste of money, nothing else. So IUI we need to understand कि कौन से cases में, when female is having good egg quality, she's her fallopian tubes are intact, that those are normal, patent, and third, her ET is good, right? And there is no history of recurrent miscarriages. जब ये सब कुछ ठीक है बिल्कुल, and her hormones are in normal level, but only the male person is having poor sperm motility या low morphology, 1%, 2%, ऐसा कुछ, in those cases only you can opt for IUI as a trial attempt, because उसमें थोड़ा सा probability increase होगा, otherwise that is not going to treat anything in you, right? Now coming to IVF once back, what IVF is intra sorry in vitro fertilization, that is IVF. छोटे होते हम सुनते थे ना, टेस्ट ट्यूब बेबी, नया नया टर्म आया था, that is IVF. What exactly is done in that? ओवम पिक किया जाता है फीमेल बॉडी में से, आफ्टर गिविंग वेरी हाई डोजेज ऑफ हॉर्मोन्स, आपके फॉलिकल्स को मल्टीपल टाइम्स स्टिमुलेट किया जाता है एज कंपेयर टू योर नॉर्मल हार्मोनल जो इफेक्ट आता है बॉडी में, उसके कंपैरेटिवली मल्टीपल टाइम्स एक्स्ट्रा हॉर्मोन्स दे के आपके फॉलिकल स्टिमुलेट करते हैं. मल्टीपल एग्स आर रिट्रीव्ड इन वन साइकिल. Those eggs are kept outside and then the sperm is taken. Test tube mein fertilization is done. Then those embryos are analyzed. उसमें फिर दे डू द ग्रेडिंग कि अच्छे ग्रेड का एम्ब्रियो बन गया है या नहीं बन गया. इफ अच्छी क्वालिटी का एम्ब्रियो नहीं बना, दे एब्सोल्युटली डिस्कार्ड इट, राइट? एंड अगर अच्छी क्वालिटी का एम्ब्रियो इज देयर, ओनली देन दैट इम्प्लांटेशन इज डन. तभी जाके वो फाइनल आपकी बॉडी के अंदर इंसर्ट किया जाता है embryo बना हुआ. That is in vitro, मतलब fertilization was done outside the body, but the fetus has been now sent inside the uterus to get implanted. Only if it gets, और वो नहीं होगा, कब नहीं होगा? When your ET is bad, when you have hormonal imbalance, when your overall health is bad, when you have a lot of stress, lot of negativity is there, even when you have poor lifestyle, bad life, sleeping patterns, poor dietary habits. आप IVF कराओ, पैसा लगाओ, मैं बोलती हूँ नहीं होगा पॉजिटिव, बिकॉज देर आर लॉट ऑफ फैक्टर्स जिसको देखा ही नहीं गया, जिसके बारे में सोचा ही नहीं गया कि हाउ the baby will be implanted and how this pregnancy will continue after this. अगर ET नहीं ठीक है तो कैसे आप उस प्रेगनेंसी को कंटिन्यू करोगे? इवेंचुअली दैट पेशेंट इज गोना हैव मिसकैरेज या IVF फेल हो जाएगा, एंड दे डू नॉट हैव एनी आंसर टू दिस कि व्हाई इट फेल्ड. So in ऐसे cases जहाँ पे ET is not good या hormones are not good, because eventually that fetus is gonna implant in that mother's body, उसी body में जाएगा ना, और वो body ठीक नहीं है, तो you will not get results. Even I have seen cases जहाँ पे 5th month, 7th month, 8th month में जाके miscarriage हो जाता है, because patient was not able to hold the baby. So there is no use of going for IVF in such kind of cases. Sometimes they say कि आप you have advanced age, you are like after now you are more than 35 years, so you do not have good quality of egg, you should go for donor's egg. आपने donor egg ले लिया, once again you need to understand that if your ET is not good or your hormones are not in the right state, how you will carry that pregnancy for 9 months, those 40 weeks means so many days. How you are able to survive that? You will not be able to. And that is the reason mostly IVF has only 35 to 40% success rate. But if we check ki homeopathy mein kitna success rate hai, as of now I am giving 90% success rate to my patients, provided that patient is listening to me, that patient is following all the guidelines we are giving to our patients, provided that patient actually has that level of patience. Because if you are consulting a homeopath and you want key within a month or so or 2 months you will have the result, you are not going to get any results. I'm very clear on this. So you have to be patient, because that is a natural process and we are promoting, we are helping you to conceive naturally. So you have to be very patient, you have to stay positive, you have to keep your stress level. I repeat this to everyone, you have to keep your stress levels in check. Otherwise agar continuously you are taking considering this as just the physical thing, eventually you need a result, you need a baby, and you are getting intimate, so your hormones are not playing a proper role in that relation, and eventually you may fail, most likely. Otherwise we being homeopaths we understand कि अगर आप just उसको एक physical thing बना के and you are getting a baby, so what kind of personality that baby is going to be in future. We understand this, we being homeopaths under that understand this. बाकी डॉक्टर समझे ना समझे, I have no idea about that. So this was my insight about infertility. If you have few questions we can take that, and after 5 minutes I'll be sharing a case. So I guess if anybody has any questions, so I can check. Okay, one question is there. Dr. Ashish Kumar Nath has asked a very common question from patient. Is there any homeopathic medicine for delaying menstrual period? See, अगर हम सही तरीके से होम्योपैथी प्रैक्टिस करते हैं, we are giving the constitutional treatment, we are giving the treatment to bring everything towards normal. How can we delay the menses in any patient? So we do not have any kind of homeopathic medicine. Genuinely homeopathic, there is nothing. आप otherwise कुछ भी दे दो patient को और periods delay कर दो, तो that is, I think, wrong practice being a homeopath. Dr. Hetal has asked the scope of homeopathy in tubal blockage. Dr. Hetal, I'll be sharing a case of tubal blockage only after this. Sai Harshita has asked, can thyroid abnormalities cause infertility? Yes, thyroid abnormality is a major reason. Even I say every hormonal imbalance, even I guess I missed in the session, even the insulin level, if that is not in the normal range, that too can cause infertility. Any and every hormone affects your health and fertility. You have to keep this in mind. Anju Sani has asked, if patient have tubercular cyst, how will we approach this case? देखिए, अगर आप genuinely homeopathy practice करते हैं, तो you must be aware of this कि whatever the disease is, whatever the name of that disease is, our approach being a homeopath is same in every case. The totally unprejudiced observer, हर केस को नए केस की तरह लो, उसको समझो अच्छे से, कैसे कैसे वो पेशेंट की जर्नी हुई कि वो पेशेंट आज ट्यूबरकुलर सिस्ट तक पहुंचा. Once you get to know that journey, you will be able to prescribe wonderfully the similimum और आपका केस सॉल्व हो जाएगा. Which test we have to suggest in early stage if pregnancy not occur? Dr. Rakesh Prajapati has asked this. Okay, अगर pregnancy नहीं होती early stage में कौन से test हम ले सकते हैं? I guess I have answered to this question already कि basic कौन कौन से test हमें करवाने चाहिए. And हाँ, one more thing what I missed and that must be kept in notice है ना कि पेशेंट को सिर्फ यूरिन प्रेगनेंसी टेस्ट ही पता होता है कि अगर वो 2 लाइंस आ जाती हैं तो प्रेगनेंसी पॉजिटिव है. बट वी बीइंग डॉक्टर्स वी मस्ट बी अवेयर ऑफ एंड वी मस्ट बी एडुकेटिंग आवर पेशेंट्स कि समटाइम्स वो 2 लाइंस जो आती हैं दैट आपका बीटा एचसीजी यूपीटी में पॉजिटिव आता है दैट कैन बी डिलेड. I always do this in my clinic. If somebody is not getting their periods in time, now we wait and wait and wait for like 2 months, 3 months. When that person was planning, they were trying to get pregnant because in few rare cases, I will say, but I have seen it like in almost 10, 12 cases till date, जिसमें for 3 months UPT was not positive, beta HCG in blood was not positive. बट पेशेंट को जाके तीसरे महीने में 4th मंथ में जाके ये पता चलता है कि दैट पेशेंट इज प्रेग्नेंट. सो वी हैव टू बी पेशेंट, वी हैव टू सपोर्ट द पेशेंट इमोशनली टू कि आप इम्पेशेंस मत होइए और अपना केस स्पॉइल मत करिए. आई गेस दीज आर ऑल द क्वेश्चंस आई एम नॉट मिसिंग. Preetha Nair is asking any specific medicine for increasing ET. See, I do not prescribe therapeutics, so I cannot guide you on this. You can have a look on the therapeutic aspect of this, but I am always prescribing on the constitutional basis. I am always prescribing on the classical. I'm working as a classical homeopath, so that is the only way how I prescribe to my patients. और इफ यू वांट फ्यू नेम्स की कौन कौन सी मेडिसिन ने आज तक मेरे पेशेंट्स को हेल्प किया, कुछ मेडिसिन आई कैन टेल यू. जैसे sulfur is very good, calcarea carb has given wonderful results, sulfur is there, natramure is there, and I have given arsenic to few patients, pulsatilla to few patients, and sabina has also helped. There are so many medicines which have eventually helped. Even कुछ केसेस में अर्जेंटम नाइट्रिकम गेव वेरी वंडरफुल रिजल्ट, कुछ केसेस में साइलिशिया वाज गुड एंड इग्नेशिया वाज आल्सो देयर. मतलब बहुत सारी सब मेडिसिन आर देयर, बट you cannot specify one medicine for because every case is different and we have to work as unprejudiced observer. ध्यान से सही होम्योपैथी प्रैक्टिस करेंगे तभी आप रिजल्ट ले सकते हैं. Shalu Malik is asking dopamine low, FSH decrease, sometimes delay menses, how to manage? See, इतने से इंफॉर्मेशन से अगर मैं आपको आंसर करूंगी तो दैट इज डेफिनेटली गोइंग टू मिस समथिंग वेरी इंपॉर्टेंट. सो दिस इज नॉट द राइट प्लेटफॉर्म टू आंसर दिस क्वेश्चन. इफ यू वांट टू कंसल्ट यू कैन कंसल्ट मी एनी टाइम. Ma'am, is there, Dr. Sonika Jindal, ma'am, is there treatment of adhesions of parts in genital tract in females caused due to infection? This is a good question. See, even only today I got a case. Patient has bicornuate uterus. Bicornuate means it is like this. There is a septum in between the uterine cavity. ये ऐसे uterine cavity है, उसके बीच में एक septum grow कर गया. The uterus has been divided into 2 cavities now. Now what to do? Most likely you will be unable to remove that septum. You have to advise your patient कि as technically अगर हम इसको देखते हैं कि about bicornuate uterus वाला patient can conceive, but the probability is decreased to higher extent. Chances बहुत कम हो जाते हैं because the cavity का space is very low and there is a septum. तो the space of getting जो मतलब implantation होना है वो कम हो जाता है. तो probability comes to a very lower side. And bicornuate uterus के case में that is always a high risk pregnancy. Every step you have to keep in check. Repeated sonographies are required and बहुत carefully आप उस patient को till delivery लेकर जा सकते हैं. And if there are adhesions just due to infection, yes, we can help with homeopathy. Fallopian tubes के बहुत सारे cases जो after infection cause हुआ and there was blockage, I have treated numerous cases with homeopathy और बड़े आराम से treat हो जाता है. मतलब people come as कि सच्ची में मैम ये हो जाएगा. That happens. We have multiple cases. Dr. Ila J. Algotar is asking, ma'am, diet and other things which we have to take care. Can you suggest anything on? See, diet will be a very vast topic. I guess Dr. Mansi, we will take this later on, है ना? Diet के बारे में हम फिर कभी बात करेंगे. And rudimentary uterus in 10-year girls, can we treat? If that person is abhi 10 years, na, yes, we can work upon her hormone levels and homeopathy do miracles. ट्राई कर सकते हैं बिकॉज जब रूडिमेंट्री यूट्रस है इन एलोपैथिक साइंस दे हैव नो ट्रीटमेंट फॉर दिस कुछ भी तो नहीं कर सकते ना बिकॉज दैट यूट्रस हैज नॉट ग्रोन टू अ नॉर्मल लेवल है ना तो अगर ऐसा केस है तो यस ओनली कॉन्स्टिट्यूशनली एंड विद टाइम दैट मे टेक 1 2 3 years or more we can try definitely we can try. So coming up to the case, I will try to share a screen here. Dr. Mansi, please मुझे बताना कि my screen is visible या
Yes,
नहीं.
ma'am. Sure, sure, sure.
I'm very good at this. Actually, I am unable to, seriously. Just one sec.
That's okay, ma'am. When you open up your
Give me a
screen,
second.
you can share your screen to the button we have share.
One second. I'll open my file here and then I'll.
Yes.
From the share button, na?
Yes, ma'am.
Share screen.
Yes.
Is it visible?
Yes, yes. We have your case.
Okay.
You can also keep it on the full screen.
Just one.
Yeah.
That was fine, I guess. है ना?
Yes, ma'am.
यहाँ से कहीं
Yes,
से
ma'am.
होता है ना?
No. Yes, ma'am. Yes, ma'am. It's fine.
It is fine.
That's
Okay,
okay.
okay.
Yes.
So I had a patient. This is a case of last year. That she is. I don't mention the name of my patient always, and I do not want to. So that patient was 33 years old, and that was a case of primary infertility. And now you people are aware of key primary infertility means they were trying since 4 years, but was unable to conceive even once, right? And she had multiple failed IUI attempts. 3 4 times they tried, but she was not having pregnancy. बहुत सिवियर एंजाइटी थी उस पेशेंट को मुझे मतलब ऐसे ही रैंडमली याद है वो केस बहुत अच्छे से इवन आई हैड पोस्टेड वीडियो ऑन माय इंस्टाग्राम पेज और मेरे को बहुत सारे मैसेजेस आए थे फ्रॉम योर प्लेटफॉर्म आल्सो कि मैम डू शेयर दिस केस क्या केस था आई लिसनड एंड लिसनड टू दैट लेडी she had a sonography report with her and clearly as I told in the detail about infertility she was having beaded appearance. I won't be, I guess, able to find that report right now because I had no, one poster presented in a seminar. If I can share that, you can see the reports there. One second. That will be a better way to like make you understand. One second, one second. Mhm. Yeah, okay. Mhm. हम्म। सेकेंड, आई एम सॉरी फॉर, आप सबको मैं वेट करवा रही हूँ बिकॉज आई कुड नॉट गेट द टाइम टू लाइक कीप द थिंग्स एट वन प्लेस. Yes, here it is. Yes. So my screen is visible to you now. Dr. Mansi, my screen is visible now. So
Yes,
this was,
ma'am, visible.
yes, yes. So this was a case of primary infertility, and they were trying since 4 long years. They had been married since 6 years, and they were trying to conceive. Had been to multiple gynecologists, but nobody was able to help. Her history was like she had irregular menstrual periods lasting for 3 to 4 days, and she was regularly having bearing down pain in the lower abdomen, especially while passing stool. And past medical history was she was having a renal calculi, which she don't remember, but she had some homeopathic treatment for that. So her female history was she had one early miscarriage and two failed IUIs were there. And उसके बाद when we went for her ovulation assessment, that is a TVS study. So there was a follicle size 22.3 into 16 mm ka size, and ET was also good, that was 7.9. But her USG revealed ki she is having the beaded appearance of fallopian tubes, which was a clear indication that she might be having tubercular salpingitis. We went for the TB gold and that was positive. So eventually, जब मैंने उस पेशेंट का सारा डिटेल स्टडी लिया तो उस दो स्पेसिफिक चीजें जो उनके हस्बैंड ने मेंशन की. शी इज वेरी पेक्यूलियर अबाउट क्लिनलीनेस. आपने अगर कहीं पे टॉवल भी रख दिया तो शील क्लीन एवरीथिंग. वो टॉवल हटाएंगी, वो बेडशीट क्लीन करेंगी. इफ शी गोज टू सम पब्लिक प्लेस, शील कम एंड इंस्टेंटली चेंज ऑल हर क्लोथ्स. और उसको बहुत कंटेमिनेटेड सा डर्टी सा फीलिंग आता था किसी को भी देख के कि आई एम वेरी पिक्यूलियर अबाउट क्लीननेस. मैं नहीं बर्दाश्त कर सकती, मुझे बहुत बहुत इरिटेशन होती है, मुझे बहुत नफरत होती है. दीज वर द वर्ड्स व्हाट शी यूज्ड. And when I investigated one peculiar thing she told कि जब भी मेरे husband घर पे नहीं होते, every time I have a very peculiar fear कि वो वापस नहीं आए. Anyone out of you जिसको कोई idea हुआ हो कि कौन सी medicine? And another thing, she clearly said this कि जैसे कैसे करके मेरी pregnancy करा दो, and I am not going for normal delivery. These were the things which clicked in my mind. मेरे दिमाग में सीधा medicine click की. I was like 90% sure. Then I repertorized her case. Rubrics used were female genitalia, sterility, menses irregular, pain in the uterus, stool urging to bearing down. Fear happens, something will. Her husband to that he would never return. This is a specific rubric. एंड डिल्यूजन बेटर देन अदर्स चीज, क्योंकि उसको हर एक को देख के ऐसे लगता है कि नहीं कितना गंदा है, ऐसा नहीं. देन शी हैड एंजाइटी अटैक्स, एंजाइटी अबाउट हर रिलेटिव्स, एंजाइटी अबाउट हर ओन हेल्थ, डिस्गस्ट फॉर एवरीथिंग. एंड इन फूड एंड ड्रिंक्स उसका स्पेसिफिक चॉइस वाज कि शी ऑलवेज वांटेड समथिंग स्पाइसी एंड सेवरी. सो दीज वर द रूब्रिक्स व्हिच आई यूज्ड. एंड एग्जैक्टली फोर्थ मंथ का उसका साइकिल, अभी पीरियड्स उसके आने थे, दे केम random routine जो follow up था. She came in my cabin. I was sitting normally, and all of a sudden she comes and says, "Ma'am, दो line है." Even you yourself sometimes do not expect such a quick response. Medicine given was Platina 1M, single dose. You trust me, single dose gave this miraculous result. Her TB was cured. She got pregnant. बिल्कुल नॉर्मल प्रेगनेंसी हुई. एवरीथिंग वेंट परफेक्टली फाइन ड्यूरिंग हर प्रेगनेंसी. कोई रिस्क नहीं, कोई स्पॉटिंग नहीं, कोई जो मतलब ड्यूरिंग प्रेगनेंसी, बिकॉज बहुत सारे होते हैं कि कभी ब्लड प्रेशर हाई हो जाता है पेशेंट का, एक्लैम्सिया, प्री एक्लैम्सिया, जैसे लॉट ऑफ थिंग्स आर देयर, बट हर प्रेगनेंसी वाज एब्सोल्युटली नॉर्मल. She opted for C-section, and recently, I guess 1 month back, she has delivered a daughter. So this was a case of blocked fallopian tube. आपको अगर डाउट है कि होम्योपैथी कैन ट्रीट fallopian tube का blockage, yes, homeopathy can. I have treated multiple cases with only constitutional treatment and the intercurrent ones. So I guess this is all from my side for today. And if anyone out of you have any queries, you're open to ask, Hannah. There are so many questions, Hannah. My God. Ma'am, in this case, which test we have to do now before starting the treatment? Sonography has to be done and all the hormonal profile has to be done. Ma'am, can you throw light on importance of FSH and LH, how to understand it clinically? See, FSH has a role on your follicles. So FSH will be the hormone in the first 14 days, first half of your cycle. It acts to stimulate the follicle. Follicle stimulate होगा, follicle का size grow करेगा, and then the ovum is released. And LH, that is the luteinizing hormone, जो बाद का जो luteal phase है, उसमें LH goes to a surge जिसमें आपका ET grow करता है, so that pregnancy can happen and uterus enable होता है to get pregnant. And when pregnancy doesn't happen, suddenly there is a decline in LH level and periods आते हैं, menses होता है, menstruation होता है. Sepia, platina are, so some of you were able to like click the medicine. Ma'am, within how many months of treatment can we assure them cure after giving Simlimum in like in an average? See, this varies from case to case. अगर सिर्फ ovulation नहीं हो रहा है and you are pretty much sure about the constitutional Simlimum, you can assure कि next month से ही हो जाएगा ovulation. But you have to have that confidence on your prescription. And अगर endometriosis का केस है तो आप उनको बोलिए कि minimum 6 months and it can take 1 year, जो ideally what we do in our clinic. So Dr. Mansi, I guess this is all from my side and we should be winding up this session. Thank you everyone. Thank you everyone for being so patient and listening to me for such a long time. And it was seriously a privilege to be on this platform and share my knowledge. Thank you.
Thank you so much, ma'am, for giving us your valuable time. And we had a
Welcome.
really very informative session with you. And we are glad that we have such passionate homeopaths with us. And thank you so much, ma'am. Recording will be
Most
shared.
welcome.
It will be soon. Recording will be shared on the
Okay.
YouTube soon.
Mm-hmm. Okay, do share the link of that YouTube recording. I'll share that on my platform also, right?
Sure, ma'am. Sure. Thank you so much.
Okay, Dr. Mansi, thank you. Thanks a lot for
Okay.
giving this opportunity. Okay, bye-bye. Good night, everyone.